WYMAN was founded in 1898 to provide children living in the sweltering tenements of turn-of-the-century St. Louis with fresh air, good food, and healthy outdoor activities. After nearly a century of service, though, it had become clear to us that the needs of youth from impoverished communities had grown increasingly complex, and that if we truly wanted to improve their lives for the long term, we needed to make a change. We also found that teens from low-resource environments were profoundly underserved. From there, we committed to providing teens with long-term, results-driven support, helping them succeed in school, build social and emotional skills, promote their mental health and their physical well-being, and cultivate an ethic of servant leadership. Our objective is to continue to grow our presence locally and nationally, to create impact at scale, and to positively influence the lives of as many teens as possible. To do this, we directly provide teens from low-resource environments with quality, effective programs. While continuing our legacy of direct service work in the St. Louis region, we evaluate and learn how to best meet the needs of teens and their communities. On a national level, we support partner organizations in affordably and faithfully replicating our programs to build a community of practice, and we're committed to delivering excellence and supporting teens to success. We also advocate to improve systems and policies so that communities have the resources they need to enable their teens to thrive in life, work, and learning. After more than a century of serving youth, we know what young people need to succeed in life, work, and learning. They need caring and competent adults in their lives, adults who connect with youth and help them become capable learners and critical thinkers, adults who teach them not what to think, but how to think. They need positive peer group experiences that allow them to learn, explore, broaden their horizons, and test their values, and that push them out of their comfort zones. They need opportunities to engage positively with their communities and to give back to the common good. And they need these three things with consistency over time. These are the cornerstones of our success and the success of the young people we serve. WYMAN's effective because of our ability to bridge research and practice. We've become adept at finding programs and processes and curriculum that work, and then figuring out how to bring them to market in a way that's affordable and effective. Then, we teach others how to use them to bring the outcomes to scale. As witnessed by our long history and evolution, we're driven by our desire to improve long-term outlook for teens from low-resource environments. And we're continuously informed by data, research, and our own experiences to improve and expand our services and the services of others. Our success as an organization is measured by the success of our teens, and teens in WYMAN programs have a 60% lower risk of school dropout and course failure, a 53% lower risk of teen pregnancy, and a 52% lower risk of suspension from school. They're graduating high school on time, they're developing ongoing and positive relationships with their peers, and making healthy choices, and they're involving themselves in service to their communities. 1 in 5 young people in this country are dropping out of school before high school graduation. These are risk reductions with the potential to make huge societal and economic impact at scale. With this in mind, we're training and supporting partner organizations in our national network to work more effectively with youth and to deliver our programs faithfully and affordably so that they can replicate these outcomes in their own communities. Our nationally replicated teen outreach program has gained much acclaim as a teen pregnancy prevention program. However, reducing teen pregnancy is only one of many areas of its impact. This comprehensive youth development approach promotes resiliency and well-being in youth by building important skills and competencies that result in dramatic outcomes in a variety of areas, from reducing risk of school failure and dropout to increasing good decision-making and personal responsibility and community service. After seeing incredible results from our direct service in our home community, we built a national network of certified replication partners. With our training, support, and best practice programs, they're able to deliver programming to positively influence the lives and communities of teens across the country. Since the launch of the network in 2009, we've trained 2,750 youth workers through 57 partner organizations to annually reach upwards of 30,000 teens across this country. Our work helps youth build skills and abilities that reduce risky behavior and prevent problems before they start. Unfortunately, most of the policy and funding meant to help youth living in poverty is focused on remediating problems. So it's an uphill battle to find and identify support. As a small local provider in a part of the country with very little foundation strength, finding growth capital has also been a challenge for us. We are responding to and learning from 22 different research studies that are being conducted on our teen outreach program as it's replicated across the country. Building our internal capacity to capture and analyze that data, to reflect on it and learn, and then to share knowledge is critical to improving outcomes for teens. It's critical to leveraging innovation and for driving quantifiable value for us and our partners to impact policy and investment. While we have a system of data collection on program implementation and teen outcomes, WYMAN seeks to build a professional knowledge management division that transforms data into actionable knowledge. By building a strong infrastructure which includes hiring the right people and re-engineering data platforms, we can develop our competencies to identify trends, risks, and opportunities that inform the refinement and innovation of existing programs and services. This new knowledge will drive program quality, outcomes, and innovation, and a better understanding of the replication and implementation processes. It will support the sharing of that knowledge, both internally and externally. With a professional knowledge management division, we hope to identify the ways and means to effectively serve high-need youth in systems like juvenile justice, foster care, residential care, and health care. We believe it's in these systems that there's the greatest potential for societal impact and economic return for communities.